All right, then this is Universidad de la Sabana Global Health course. This is the third part in Unit 1 discussion. And here we're going to review some of the basic definitions of global health. But one of the things I did want to point out about this map we've been looking at is that it is actually a map of life expectancy. So you can see in the red countries here in Central and Southern Africa, like Democratic Republic of Congo, Angola, Zimbabwe, the life expectancy is less than 40 years of age. Whereas in countries like Canada and Australia, the life expectancy is much longer, say in your 80s, or Spain, and actually Colombia has a very good life expectancy with more people over 100 years old than anywhere else in the world. So healthcare and access to health in Colombia is quite good. But it's all a part of your perspective. Then what is global health? How is it different from public health, international health? Well, global health encompasses a full breadth of public health issues worldwide. And so we're talking about threats due to terrorism, climate change, epidemics, threats like the Ebola outbreak, tobacco control, obesity, so non-communicable diseases, migrant worker health. So these are all things that are considered for global health that really aren't so much a part of international health. So health is a state of complete physical, mental, and social well-being, not merely the absence of infirmity. You can see that health can be a very complex network of different impacts, not just your well-being and your prosperity, which are very much a part of your health, but health care is only one box here. You can see health function, health care, your social environment, physical environment, genetic endowment. So these are all very complex network of impacts that allow you to have good health. Public health is more related to prevention rather than curative. So again, public health in a way is the shell in which we build for global health. It has to do with populations rather than individuals, and it has more to do with decision making. So for the nation of Colombia, you have excellent health initiatives in the country, and you use public health as a platform to make policies and decisions about what should be offered in your country to make sure that people have good health. The definition, again, we're promoting physical health and organized community efforts for sanitation and improving the quality of the environment, preventing communicable disease. So that really is the emphasis for public health. The scope of public health focuses on issues that affect health of the population. Health equity is only one component, and encourages multidisciplinary approaches. So it's not just physicians and nurses, it is a lot of other kinds of health practitioners that work together within public health. International health, again, is concerned with access to clean water and sanitation. It focuses on developing countries, so you might not really know about things going on in, say, Australia or the Netherlands. They aren't really part of international health. International health focuses on developing countries like Zimbabwe, or you might consider Bolivia, or some other nations not in the developed world. And we're health related to, it's beyond involving your own country, so it's not just public health in Colombia, but we're looking regionally for Peru and Ecuador and Venezuela. The definition of international health has to do with the prevention of malnutrition. You want child health to be part of that, and maternal health. Plans about have both social, economic, as well as cultural dimensions. So if you were working in Colombia, but working in Amazonia, there would be special impact and consideration for culture. The development and implementation of solution requires binational. So say Cuba working with Haiti, for example. That would be international health. Cuba has very good health systems, and they would help support the recovery of Haiti as they're restoring their whole infrastructure, including their health system. Whereas global health is a field of study, research, and health practice that has priority on health equity for all people. So they look at the entire environment for health and how they all impact. So you see it gets bigger. You have public health. Global health is much bigger and encompasses all the other international health and public health. It's an interdisciplinary collaboration and emphasizes transnational health issues. So Australia or New Zealand might advise Thailand or other countries in Southeast Asia about successful systems for improving health. Global health involves all the health sciences. So it's not just, again, physicians and nurses. It has to do with statisticians. It has to do with logisticians. It has to do with a greater variety of health professionals. Global health, complexity of mitigating health threats. So again, we are talking about humanitarian aid, but we're also talking about internally displaced people that in Colombia or Sudan that requires a multidisciplinary approach where we have humanitarian aid coming in. And it's between developed and developing countries. So again, we might take advice from how the Spanish health authorities manage better to learn successful models that may work well in Argentina. So that was why it was considered global health. The scope of global health includes a greater level of cooperation and collaboration, access to health services. We're talking about health equity, which is also part of international health. So we have these rings. So we have public health as the basic core competencies of all these health interventions. International health, again, mainly focuses on developing countries, whereas global health includes your stakeholders, and it actually talks about developed countries like Colombia could give good advice to Bolivia or Paraguay about the health systems that are successful here in Colombia that might also work well in those countries. So that would be more global health. The World Health Organization has priorities that have related to what they call Millennium Goals. So we have the prevention of child malnutrition and underweight. We want to have fewer communities that have unsafe water or limited access to sanitation. HIV, malaria, and tuberculosis are infectious diseases that they really believe are within our power to prevent and actually cause the elimination of these diseases. The response to natural disasters. So with climate change, we have a huge increase in the number of natural disasters. Emergency preparedness for pandemics. We were prepared for avian influenza. We were prepared for Ebola. We were trying to respond to these types of global threats for infectious disease. In the past few years, people around the globe have experienced greater economic insecurity because of the crisis, monetary crisis, and it has impacted the amount of resources that are available for health services, and people unable to pay for their homes, inadequate health care resources, inadequate food. So there are lots of employers that are cutting back, and so people are losing their jobs. And again, there's been a widening gap of inequity as people have fewer resources to spend on health or good food or healthy environments, a safe home, then they also are exposed to more health risks. Global health disease surveillance, again, we have the surveillance capacity of developed countries. World Health Organization is based in Geneva. Pan American Health Organization, I believe it is based here in Colombia. At least it has been in the past. Now it may be based in Brazil. But again, these are organizations that use community-based resources to look at global health issues in regions. It takes action, and this is what we were trying to do with this class, is motivate you to take action, to see that there is something that you can do as a student, or even as you graduate and become health professionals, you can do. You need to take action and work together with other health professionals. You want to change the world, but it cannot be done alone. If you really want to do something, you absolutely will find a way. I have been so impressed with the student responses and solutions that they have come up with when they're in the simulations of this course, and I think that that will happen using the virtual Savannah course format as well. Why should we care about Africa? It's very, very far away. It's a myriad of all different types of countries, and I think that I wish I had put the map in to show that North America, South America, and all of Europe could fit into the continent of Africa. So that emphasizes the diversity that represents Africa. So why should we care? I mean, what difference does it make? We have a reason to care for Africa. Does it impact us truly? Not really. But compassion separates us separates humans from animals. And as far as I'm concerned, God did not make us all equal. This is a man who is faced with desperate situation. This is in Sudan, where there was a drought, and all their animals, which would be considered their resources and their wealth, were gone. There's not enough food for all of us, is what some people really believe. East Africa drought crisis, we've got a lot of children that are actually starving. You see, the animals here are dying. The severe drought in the Horn of Africa, so that would include Kenya, Ethiopia, Somalia, even parts of Uganda, and of course Djibouti. It's about 11 million people that were on the brink of starvation, and they didn't prepare well enough to even, as the aid came in, they couldn't get it to communities fast enough. So that's why it's a lot more than just healthcare professionals who are attacking problems of global health. It has to be transportation, it takes pilots, it takes trucks, it takes a lot to get aid to communities that need it. Their only meal might be a meager boiled beans or made with cooking oil. They might have to do without food for days. And again, emergency supplies were very slow in coming, and this is considered the Horn of Africa. So you can see that this is the parts of it. Doesn't go down to Tanzania, but Sudan, Eritrea, Ethiopia, Somalia, Kenya, and Uganda. Why should we care about of Africa? Do we have that compassion? Do we have that spirituality that makes us different from others? Why should we care about Africa? Again, there are NGOs and organizations that are charities that we support, and again, the Mamayai is about ensuring African mothers and babies survive even during pregnancy, because again, you need a higher level of nutrition when a woman is pregnant. So it's a campaign that was started by communities. If you want to change the world, you can't do it alone, but if you really want to do something, you'll figure out a way. And these organizations, you can contribute to them, you can organize your own organizations, you can actually take an initiative. And again, why should we care about Africa? Look at what recently happened. We were watching in the news, wondering when the first case would be coming to our hometown. I know Colombia was one of a few countries that actually banned any flights coming in from West Africa that might be coming directly to Colombia. Unfortunately, lots of people can travel from different parts of West Africa to Europe and then over to the United States, to Canada, to other destinations where they might be able to get better health care. And again, this is all part of why we should care. This is Unit 1 for Global Health, and this is as Part 4 to detail about the student evaluation, because I know that you all are concerned about details of how the grades will be calculated for Global Health. We were wrapping up in Section 2. We were talking about saving lives and changing minds, and how I was mentioning that it's better to teach someone to fish than to give people fish. Although humanitarian aid, you go in and help them short term, the long-term benefit for global health is to actually change or build capacity within the national teams. And I think that that's what we're preparing you to do. So for student evaluation for a global health course, it's a 2-unit class. That means that you should expect to spend about 2 hours a week doing the different reading assignments and working on your upstream global health challenges. There are 8 steps, so every other week you'll be working on those and doing your reading. The biggest points, the 40% of your grade is actually a student project that you'll work on with in a group. You can work on it alone, but you can have up to 2 or 3 students in a group preparing a global health presentation. So that's how the class participation is 10%, upstream challenges is 20%, your assigned readings in which you need to reply in short answers or giving definition of terms is 30%, and then the country project. Just remember that your homework assignments are to be submitted through Virtual Savannah online, and please send them in on time. So I have discovered that in the last 3 years teaching this class that sometimes people get really busy, and so I had to really ask you to turn your assignments in on time. It's unfair to other students if you turn yours in late and have more time to prepare than when they rush through trying to submit it on time. So I actually deduct 20% of your points for an individual assignment for every day that the assignment is late. So please just submit online on time. Student assignments, I'll be giving you reminder notes. In February we'll check your progress with Half the Sky, the game that is part of this course. In March I'll give you like the midterm tally points, the different points that you've gotten for your homework assignments, different discussion, participation, so you'll have a way that you will know if you need to get some extra credit. There are some videos that you can watch that if you can give me a summary of them, like the Rwanda, there's a Rwanda video that you can watch. So again, these are ways that you can get extra credit if you actually discover that your tally points are lower than they should be. I understand that many of you are scholarship students and you really want to keep your grades high. This is a 2-unit class, elective, and we're trying to make it fun and easy for you to get the points you need to get your best grade. In May we'll have your virtual live presentations, either a video or a PowerPoint that you've set up. There is no final exam, so during the final exam period you can be free to study for your other subjects. So in-class participation is important. We'll be completing Jeopardy games, and I'll be sending out answer sheets so you can see how you did in recognizing international locations. Classroom debates, it's important to join the forums and participate. I will be checking to see who all has contributed and made comments. Your upstream global health challenges, there are 8 of them, so again it's listed here. It's set up as in a game format, again to look at the basics of water, food, safety, shelter, and then ultimately you're going to be designing an action plan, hopefully modeling after the world we want, the youth programs that they have supported with actual community interventions. Here's a picture of the Jeopardy board. It's actually quite fun. I use this as a teaching tool in some of my other health classes, so it's always a lot of fun. Here's an example of one of the questions. Meet the challenge. Name the country. So is this France or is this Mexico? You know, so it's just to refamiliarize you with the fact that it's not always so easy to identify an individual country just by looking at it, but then also the commonality is the problems that people might have for, say, nutrition in sub-Saharan Africa. They're equally important in parts of Latin America. So again, your awareness of geography for global health is really important. I realize that the global health challenges, you can get really excited and want to do more work on them. I know you have limited time because you all have physiology and you're memorizing the different things for calculus if you're an engineering student. So the challenges can be a lot, so just scale them to being the 2 hours a week is good, and then we can say the challenges are we're going to be battling upstream like the salmon do in the summertime here in Oregon, to go even to meet the challenge of jumping up over a waterfall. So the interactive learning, again, it's participation with the forums. The debates will be you're typing online. Don't worry about spelling or grammar. You'll be doing matching competition. We have different ways of teaming people up. We're going to be using our pink and yellow Kirby team. So we're trying to figure out ways to integrate the game format into this online class. Reading assignments, again, it's a weekly assignment. We do have some assignments from the textbooks, which are available in PDF forms. So you just see Unit 1, and then within there you'll see that you can download the reading assignment that's part of a chapter from our textbook. We'll be looking at online humanitarian videos, and I think that these are inspirational, but they also have good information, because for me, I really learn by seeing pictures and participating with different activities. And also the complete syllabus for global health is available online in a PDF form. So if you had questions, the details are all there written within a document. Again, you can download this textbook if you want to, so you'll have the complete book in an e-format. It is available for free online because they have a new version. The country reports, again, I'd like no more than 2 or 3 students in a group. You can work independently if you prefer to. We choose one global health topic, say nutrition, child nutrition in Zimbabwe, or HIV in Argentina, and one developing country. Student groups, you'll need to have either your PowerPoint, which summarizes it, your topic, or a video completed by May 15th, so you've got the entire semester to work on it. Again, step by step, 2 or 3 students together, student group, country topic. Then I have a matrix, the selecting countries and the topics, so that will be going into detail about that when you start working on your projects before Easter. I'd like a bibliography, references, and I have a list of recommended online references that have good, correct information, accurate information. The PowerPoint deck should be about 30 slides. So, and again, a video with all the participants speaking or showing or demonstrating things would be up to 30 minutes long to share with the class. The outline for your actual project, it needs to cover information, general information about your country, the topic, also how it links back to the World Health Organization global health priorities. They're called Millennium Goal linkages. And then I'm going to have at least 4 examples of successful programs and 4 examples of the challenges that they faced, even failures, because that is what happens, and that's how we learn what works within individual cultures, within individual communities in all the different countries. They're different. I also, a good portion of the time, I'd like to hear your opinion. Now, that is where you have the creative contribution here, and your recommended solutions. That is, I would say that was really important. And also the next step. So more than half of your presentation should be, okay, here's the problem, but what we're actually recommending we could do, and here are the models from the successful programs that you've read about that actually you feel would work. And again, I really would like to see documented at least 8 references. You can have more. Sometimes it's easier to get more sources. So let's join the Global Health Adventure, and I'm just going to, you can submit your questions either on the discussion forum or separate emails to me individually. Now we're going to watch part of the video that introduces you to Half the Sky, the game, because again, this is part of your course and you'll be getting points and credit for the individual completion.
Half the Sky is a multi-platform project. We're making a very important and very engaging 4-hour television series. But at the same time, we're producing mobile games, and we are making a social networking game on Facebook.
Facebook games are really special in the gaming world.
There are women in their 30s and 40s, even up to 50, who might be playing for the first time.
And the numbers are really big. Farmville is one of the most successful games on Facebook. The whole idea is that as you make progress, you need to invite other people to complete quests or different challenges. And for us, this idea that you can actually play with your friends and invite them is the main reason we chose Facebook for Half the Sky. What could be more ideal than a game that is all about recruiting more people into this global movement? You are going to meet Radhika. She's an Indian woman, and you're going to take her on a journey from oppression to opportunity.
We start in India, we go to Kenya, Vietnam, Afghanistan, and the US. Radhika will be your gateway into meeting other women and their situations in these other countries.
And all those challenges is the quest you need to complete. Some of them would be around maternal health, some of them around education, economic empowerment. It could be a quest around gender-based violence. You can actually take action that will affect people in the real world. The way we're doing it is that we collaborate with some of the leading NGOs in the world.
Room to Read, GEMS, UN Foundation, Toastin, Heifer International, World Vision, One, and the Fistula Foundation.
At the end of a quest, we give you the option to donate real money to those NGOs, and it's always connected to the gameplay. So, for example, if you need to get a virtual goat in order to complete your quest, you also have the option to give a real goat and donate it through Heifer International.
We're making substantive change along the way. We are making a game that will engage millions of players.
A win for us would be greater interest, greater conversation, public discourse around issues facing women and girls worldwide.